Hi everyone, hello, how you all doing? It's been a while, hope you're all well. Thank you to everyone that has newly subscribed, and thank you to everyone else that has stayed subscribed, considering that I haven't filmed anything in such a long time. Thea is lingering around here, so any weird sounds and things is her, so I apologize in advance for that. I just wanted to film because something's happened recently that's really bugged me and it's really annoyed me, and I just feel like I need to let it out, and then once I let it out I'll be over it, hopefully. So that's why I'm just doing this today, and I'm sorry that my first video in such a long time is me complaining and moaning, but I really have to let it out because I feel like if I don't, it's just going to keep filling me up and it's going to really upset me for a long time. So if I let it out, it'll be all good. And so thank you for watching me moan and complain as usual. So yeah, so in the last week or so, I had found a lump in down there in my lady love area, and it was I noticed over the weekend, and then over the couple of days afterwards, it kind of got painful and really irritable to the point where I couldn't really sit properly. So Monday I called the GP and called to book an appointment. I called to let them know because I have autoimmune liver disease, I'm on immunosuppressants, so anything like that I automatically get like extremely, I go from 0 to 10 like straight away. So I just called the GP straight away, and I was like, I explained the situation to them, and the doctor called me back in the afternoon, and she was like, come in so I can have a look at it, because you know it could be something serious. So she told me to come in the afternoon, but around like 4 or something, and then because of where I work, it would take me quite a long time to get there, so I would have to leave work a bit earlier than normal. So I had let the appropriate people know that I needed to leave early and to go for the appointment. 2 things annoyed me. One, in the email I had said it was something personal. Thea, sorry, move. In the email I had said it was something really personal and urgent that I needed to go to the GP for. Now, if somebody says that in their email, that it's personal and urgent, and they don't really describe what's going on, that should be an indication that they don't really want to go into details about it, because it's private and quite personal, and they don't want to discuss it. I had a call guy asking me what it was to go into more details, and it just annoyed me because, like, if you get a female staff member who says that, or anyone actually, you don't have to be female, but someone who says that, I'm sorry, but you just have to take their word for it. There's no need to be asking for more information. But I was just irritated by then, so I just blurted it out, and I just went, I found the lump and I need to go and get it checked out. And yeah, and then the next thing that bothered me was I'm telling them that I have found a lump, and my GP has given me an emergency appointment to go and see them, and then I'm getting told, okay, that's fine, you have to leave, but you need to make time up. And you know what time they're asking me to make up? Just the extra 2.5 hours. 2.5 hours to make up that would have been left over from me from work, because 2.5 hours makes such a great difference in the work that I do. And considering this was an emergency, you would think that maybe management would have a bit more empathy and a bit more compassion and just be like, oh, that's fine, go for it. But no, they were like, okay, go for it, but are you coming back to work in the afternoon after you're done? You have to make up the hours for it. And it was just, I was just so annoyed at that, because I was just like, this could be something really serious, and your first thought is making up hours. It's not the well-being of your staff member, it's the hours at work. And it's just a lot of things that's happened really in this job that's got me thinking, like, one, I don't want to continue working here for them, and two, that management do not care. Like, it's so weird of me working in the NHS and finding out, like, I mean, I've known since I started working in the NHS since 2014 that these people generally don't care about your health and well-being. It's all about their input and the numbers they can go back and report. And so you are going through something, having an emergency, it's really a backthought for them. And this is the problem. This is why retainment is such an issue in the NHS as well, because the well-being of staff members is just always at the backhand. It's always the needs of the service comes first, but it's like your service won't run properly if your staff members are not looked after properly, if they're not given any compassion, any empathy, any care. So how are you expecting to run an effective service and provide good work if you're not even bothered to make sure that your staff members are doing well? You know, it's been such a long journey for me in the NHS, and I found I've literally only had one manager I could say hand and heart who has been really caring, and one department where I felt like they were actually generally nice people and I enjoyed working with them, and they were okay. They stressed me out at times, but they were okay. Whereas everywhere else, it's just been such a battle. It's been so frustrating. It's been angry. I've been angry. And I get, like, people will say it's probably me. It might just be me. It might be I have a really horrible personality and that's why I don't get along with the majority of people I work with, maybe. But I've never had somebody complain about me directly. So I don't know. I've never had a direct complaint that I've been told about anyways. If they have complained, I've never heard about it. I've never had any patients or their family members complain about me. So I don't know. But I just feel like these managers, like, sort it out, stop being so horrid to your staff members. Because somebody telling you they've got an appointment because of a lump is serious, is absolutely serious, but you going on about extra hours, making up the time for it, 2.5 hours. I'm so sorry, I finish work at 5, I'm asking to leave at 2, and then you're asking me if I'm going to be back at work after being told that. It's so irritating. You know, I had issues when my mum passed away as well this year, and I was needing time off and things like that. That was also an issue. And it's just like, how can something like that happen to somebody and your first thought is, oh, when are you coming back to work? It's just so horrible. It's just so horrible. And honestly, if it wasn't for liver disease, I don't think I would have stayed in NHS for this long. It's the fact is, I cannot get a job anywhere else outside the NHS or outside public sector, because they would just be like, after like 2 or 3 appointments or 1 hospital admission, they'll just be like, we can't keep you on. We need somebody here all the time. You gotta go. So yeah, that's my little rant. I'm sorry that's my first video and it's me coming back with that. Hopefully my next video won't be so many months away and it won't be as negative. I'll hopefully come back with more positivity. Faye is here. Faye, say hi. Say hi. Say hi. Hi. She doesn't want to say hi and the camera's gone weird. I'm using my phone because I can't be bothered to get my camera out and it's just terrible filming right now. So yeah, I hope everybody has a better day, has a happy Sunday. Yeah, so I hope my next video will be a bit more positive, will be a bit more better. I don't know if you can see, I've dyed my hair blue. It's blue. Yeah, so that's the positive thing I've done. So when I get stressed and annoyed, I bake and I dye my hair blue, or any other colour I can think of at the time. But yeah, thank you for watching, everyone. Hope you have a pleasant afternoon and evening. I'm wishing you all the best. Bye bye.